All right, so we're going to go ahead and get started. My name is Nina Smith-Bankhead, and I'm with the Emory Campus Coordinating Center in Atlanta, Georgia. And I am here with our partners from the Southern AIDS Coalition and the University of Houston School of Social Work, who are also our Campus Coordinating Center partners. Today, you're going to hear from Mrs. Dafina Ward, who's the Interim Executive Director of the Southern AIDS Coalition. And you will also hear from Mr. Marcus Stanley, who is the project officer at the University of Houston Campus Coordinating Center. Again, my name is Nina Smith-Bankhead, and I'm the Director of Capacity Building and Community Engagement at Emory University. Before we get started, just wanted to go over the webinar, the agenda for the webinar. Today, we are going to talk about an overview of the campus initiative and our funding opportunities. We're also going to provide an overview of the Transformative Grants programmatic focus areas, including Emory's focus on building organizational capacity, University of Houston's focus on enhancing well-being, mental health, trauma-informed care, and substance use. And finally, we'll talk about Southern AIDS Coalition's focus on interventions addressing HIV-related stigma. We'll also review the Transformative Grant requirements, submission and review process, and important dates. And finally, we will have a Q&A. If you could hold all questions until the end of the webinar, we will answer all of your questions. And if you have a question, you could go ahead and start sending those questions through the chat feature in Zoom, and we will address the questions toward the end of the webinar. Also, if you haven't put yourself on mute, if you could do that, that would be great so that we can manage the background noise during this webinar. Okay, so as many of you know, the Campus Initiative is comprised of 3 coordinating centers, and we talked about those earlier: Emory University, Southern AIDS Coalition, and the University of Houston Graduate School of Social Work. The mission of the Campus Coordinating Centers is that we are guided by local communities disproportionately affected by HIV in the Southern United States. And each of our 3 coordinating centers are working collaboratively to build capacity among organizations, institutions, and other entities to reduce HIV and AIDS disparities in care and advance equities across the Southern United States. As a collaborative, we have identified 4 shared values that each of our coordinating centers stand behind. Those shared values include meaningful involvement of people living with HIV, and through that, we aim to ensure that people living with and most affected by HIV are involved in every level of decision making. And we also, And we also recognize that meaningful involvement of people living with HIV are important at all levels of our funding initiatives. Our second value is intersectionality and social justice, emphasizing racial justice. By that, we mean that we recognize that social privilege and oppression influence access to and allocation of resources and services based on race, culture, gender, sexuality, language, class, age, and ability. We also affirm the importance of advancing justice by increasing access to resources and services among groups disproportionately impacted by HIV, and we aim to increase equity of access and resources by centering our efforts that reflect the demographics of the most impacted members of our communities. Our third value is that we represent, or we share openness, transparency, and learning. By that, we strive to demonstrate and promote a culture of integrity and transparency, and we strive to be adaptive and open to learning from our challenges and successes while working in complex institutional and cultural environments. Finally, our last shared value is collaboration and commitment. We base our collaborative efforts on mutual respect and mutual support, both internally and externally. We commit ourselves to developing trusting relationships and aspire to treat everyone who works with us with respect and understanding. And finally, We are committed to collaborating with and serving communities and areas with the greatest need. Our community investments aim to address the HIV epidemic in the South by supporting, growing, and working with organizations who focus their efforts on the community. We do this by offering free trainings, shared learning opportunities. So some of you may have heard about some of those, including our Learn workshop, our Power workshops, and a number of our pilot partners, and some other services that we provide through the campus coordinating centers. And finally, we also do this by offering grants. And so you may have participated in or received a core grant, a Spark grant, an action grant, or today we're going to talk about our transformative grants. As many of you know, the Gilead Campus Initiative stands for Commitment to Partnership in Addressing HIV and AIDS in the Southern States. Campus is a $100 million commitment over 10 years to support organizations working to address the HIV epidemic in the Southern United States. Other aspects of our campus initiative include our corporate giving programs, independent medical education grants, and the AIDS View Partnership. Again, the goal of Gilead Campus is to create a lasting impact in the Southern United States. Now, at this time, I'm going to speak a little bit about the campus coordinating centers. And so you'll hear from each of the coordinating centers themselves and you'll hear them speak about their transformative grant opportunities. And I'll start with the services or the grant that's available through the Emory Campus Coordinating Center. Emory's Coordinating Center is through our Rollins School of Public Health, and our grant-making initiative seeks to create long-term sustainable change in leaders, organizations, and ultimately communities by supporting capacity-building strategies that strengthen the infrastructure and support the viability of HIV and AIDS service organizations. The Emory Coordinating Center provides support for the units within the agency that serve the agency as a whole and not on any one program. So again, when you think about if you're interested in applying to the Emory Campus Coordinating Center, our focus would be on services that support the operations and the management of the organizations, not focused on any one program implementation or any one program service that you may be providing through your agency. The Emory RFP for transformative grants will allow applicants to apply in 2 areas. The first focus area is on infrastructure development projects, and we'll speak about what that means in a bit. And the second focus area is on building intentional alliances through coalition building and network development. And this year, we're offering an opportunity for organizations to partner with non-traditional partners, meaning organizations that may not have had as much experience in HIV, but have transferable skills that this HIV community, that our field can learn from. So focus area A, infrastructure development projects, will seek proposals that should strengthen the overall effectiveness of an organization and may contain a combination of activities and strategies. Examples of work that may be eligible under this focus area could include strategic plan development, board and leadership development activities, finance and administrative system activities, service delivery and impact enhancements, communication plan enhancements or development of a communication plan, internal management and operations focused activities, and development of strategic alliances and partnerships, among other areas. Projects that we've funded in the past that have utilized these, that have fallen under focus area 1, may include revising or revamping a board of directors. It may include an efficiency assessment, so looking at all of the services within an agency and conducting an efficiency study to see if those services are providing the best outcome that they can. So that may be focused on program evaluation. And we've also supported a few conferences in under the development of strategic alliances and partnerships. Focus area 2 excuse me, includes building intentional alliances through coalition building and network development with non-traditional partners. Each organization that's a part of this collaborative is responsible for fully implementing project goals and objectives. A separate budget for each organization should be submitted with this proposal. However, combined requests should not exceed $100,000. The lead organization, excuse me, should set up an agreement with each partner organization to cover any cost that the partner organization may need. Within the collaborative project, only the lead organization is required to meet all eligibility criteria. However, all partners must be located in and doing work in the 9 Deep South states. Each organization within the collaborative project should identify one point of contact to communicate with Emory, and this organization will serve as the lead who submits the actual proposal. And finally, any power differentials among organizations should be acknowledged, and value agreements must be developed to ensure decisions, votes, information sharing, access, and resources are distributed equitably among all partner organizations. When we speak of coalition building, there are a number of models of coalition building that an organization or a group of organizations may choose. You may seek to apply as a topical committee, which means that you would be engaging a collection of individuals who bring unique knowledge and skills to resolve a particular issue or develop a document or process that benefits an entire group. You may decide to develop a network, which would develop a roundtable or a coalition of organizations to organize themselves for the purpose of resource and information sharing. You may seek to develop a task force, which would include creating a team that works on a single defined task of effort that answers or addresses a short-term need. And finally, you may choose to develop a community approach team, which would be a group of coordinated organizations formed for the purpose of establishing a response protocol to fill a gap of access to services, access to other resources, or for professional development purposes. Some considerations for applications that are seeking to apply to the Emory Coordinating Center under capacity building would be that we encourage applicant organizations that are led by and or serving marginalized communities, including men who have sex with men of color, women of color, transgender and gender non-transforming individuals to apply. We also support staff positions and or consultants, and those would be acceptable requests under this funding initiative. Grant recipients that choose to hire consultants to assist with capacity building efforts are not required to work with any particular consultant, although that selected consultant may be approved or may need to be approved as a part of the final stage of this application. And finally, organizations can request funding for project-related costs that include items including meeting space, relevant travel, equipment and supplies, and additional training. So with that, I would now like to introduce my colleague, Mr. Marcus Stanley, and he will talk about the services or the RFP available under the Sustained Wellbeing Campus Coordinating Center at the University of Houston. Marcus?
Thank you, Nina. As Nina has just stated, my name is Marcus Stanley, and I'm the project officer with the Sustained Wellbeing Campus Coordinating Center, located in the University of Houston's Graduate College of Social Work. Excuse me. And we're focused on building the capacity of organizations around wellness, trauma and healing, mental health, substance use, with a special emphasis on harm reduction and opioid use. And here at the Sustained Center, we recognize and value the intersection of practice, especially of social and racial justice, meaningful involvement of people living with HIV and AIDS, and the collaboration and commitment. As it relates to the content areas in which we are funding the content areas of wellness, and we define wellness as the as an active process of becoming aware of and making choices towards a healthy and fulfilling life. And as it relates to this content area, what we are looking for are physical, psychological, emotional, and spiritual, environmental, financial, and economic, intellectual, occupational, and as well as employment factors. One example as it relates to the content area of wellness and a program as it relates to a content of wellness would be a program, the grassroots program that's a psychological, educational, group-based workshop created for and by transgender women of color to enhance wellness among community members. As it relates to mental health, funding for mental health can include programs with one or more of the following components. Reframing mental health services, instead of using language like mental health services, make an effort to repackage mental health as part of a suite of healthy use screenings and services to increase utilization and to eliminate the fear of stigma in assessing support. Another program that could be funded under mental health is a program under Healing Justice. And we define healing justice involves members of communities that have experienced persistent structural oppression to co-create wellness by addressing collective and historical trauma through social transformation. And we understand that healing justice is necessary in a society that criminalizes Blackness and structurally ensures trauma for Blackness while creating no space or time or resources for healing. As it relates to our content area of substance use, we're paying specific attention to the opioid epidemic and harm reduction efforts. This is not to say that we are eliminating all other efforts of harm reduction or of substance use, but we just have particular focus on the opioid epidemic and harm reduction approaches. And as it relates to substance use, we're funding substance use programs that include some of the following: reframing substance use services to include harm reduction, orientation, and services. And we define harm reduction as an approach to service provision and a set of practical strategies that aim to reduce the negative consequences associated with drug use. Harm reduction centers people who use this drug, affirming their autonomy as primary agents of reducing the harms associated with their drug use. Another example of some programs that could be funded is a rapid response program that provides care to those impacted by or at higher risk of the opioid epidemic, and/or incorporating evidence-based programs or practices, not limited to, but to include those practices such as expert screening, brief interventions, and referral to treatment, ASC, adaptive step care, and other programs. And as it relates to telehealth, we're funding telehealth in the contents of mental health, substance use, trauma-informed care, and wellness. And these are programs that could increase the reach and accessibility of mental health services by leveraging technology or video conferencing or smartphones, or building the infrastructure that's training and protocols and equipment, bandwidth access that is necessary to support the pilot program, scale, and replication. An example of one of the trauma-informed projects that has been funded is the development of an organizational and regional trauma-informed care capacity building to provide trauma-informed services and to create a train the trainer in the region as it relates to mental health, substance use. We had a project that's expanding a community health worker program to increase mental health and substance use referrals. And as it relates to telehealth, one program that has been funded is a program that has expanded mental health services to break down the barriers of transportation and accessibility for the Latinx communities. What are we looking for and what are we encouraging in projects? Well, we're encouraging projects that are innovative and out of the box and grassroots oriented projects. Those projects that you have seen that are anecdotally working in your communities, however, do not have that quote unquote evidence-based research or the evidence-based data to support that. We want to work with organizations to actually develop that database and to actually help tell that story. We're also funding projects that are evidence-based, as I stated earlier. For example, experts or screening, brief interventions, and referral to treatment, as well as trauma-informed care. We're also encouraging projects that are developed and implemented by and for the communities in which the project or intervention is meant to be serving. And then also, we would like to encourage projects to not just create change on individual level, but also look where you can create change on the organizational level, and also how you can make change on the systematic and environmental levels as well. Some of the key takeaways as it relates to the RFP for the University of Houston is that if you're proposing telehealth, please ensure that you mention the focus area in which you will be applying for telehealth, which you will be applying telehealth, the telehealth practice. In addition, ensure that you are only selecting one focus area, and ensure that you must, and we also would like that you all incorporate the ways in which we will be working with people living with HIV into your proposal as well. And that is it for the University of Houston, and I will now turn it over to my colleague, Ms. Daphne Ward.
Thank you so much, Marcus, and thanks to all of you for joining us for today's webinar. My name is Daphne Ward, and I serve as the Interim Executive Director for the Southern AIDS Coalition, and we are thrilled to be one of the 3 coordinating centers. The Campus Coordinating Center at SAC is responsible for raising awareness, education, and also for the development of campaigns with a focus on HIV-related stigma reduction. The mission of the Southern AIDS Coalition is to end the HIV epidemic in the South, and we do that through intersectional advocacy, capacity building assistance, leadership development and education for persons who are living with HIV, research and evaluation at the community level, and also around policy and advocacy, and through strategic grant making like what we're doing here through Transformative. Our vision at SAC is that anyone who is living with HIV in the South will have access to high quality, equitable health care, essential support services that are free from stigma and discrimination. In addition to that, we want everyone in the South to understand the risk for HIV transmission by receiving routine screening, having access to a full range of prevention intervention services, harm reduction services, also in a way that is not stigmatizing and that is fact-based. So our work through Compass shows up in 4 ways. We provide trainings to organizations so that they can be better prepared to provide non-stigmatizing care that is culturally competent, culturally appropriate, and respectful. And we do that through trainings around not just HIV and stigma, but also the specific needs of communities that have been traditionally marginalized. Additionally, our shared learning opportunities, through those we are piloting interventions that have been developed by folks who are living with HIV in the South to address the way that HIV-related stigma shows up, be it at an individual level, community level, or through systems of care provision. And in doing that is our hope that we can help to build the capacity of leaders living with HIV in the South as a means of addressing HIV-related stigma through their own advocacy and promotion of messaging. Through our Spark grants, we fund smaller grants to lead community-based grassroots efforts based in HIV education and awareness with a focus on community-level stigma reduction. So by focusing on funding of community-level campaigns that are developed at the ground level, heavily informed by those who are living with and impacted by HIV, to spread messaging in communities where you don't traditionally see HIV-related messaging. And lastly, today, we're discussing our transformative grants, where we fund the design, implementation, adaptation, and evaluation of interventions to reduce HIV-related stigma among persons living with HIV in the South. So what do we mean when we talk about intervention? We mean any combination of program elements or strategies that are designed to reduce internalized HIV-related stigma. So an intervention would be any combination of those things. It's going to influence knowledge, attitudes, beliefs, or skills among persons living with HIV, increase social support for those persons, and or to create supportive environments, policies, and resources for persons living with HIV. So we encourage homegrown approaches that could be impactful in the community in which you serve and could be models and replicated in other parts of the South. So it's not just Debbie Ebby and all of her cousins, as one of my colleagues has said, but it's an opportunity to truly bring in what we know works on the front lines in our communities and to package that in a way where we can learn from that and improve the way that stigma is showing up in our communities. We have funded a range of interventions through Transformative, and we wanted to share some examples so that you could see that when you've seen one intervention, and that there are a range of activities that could be proposed that could be effective in addressing HIV-related stigma. So we encourage collaboration, definitely with persons who are living with HIV, in the development of community-based education programs. So this year we have funded an intervention that's focused on engaging and educating the family members, be that biological family or chosen family for persons who are living with HIV, to increase their capacity to serve as advocates and resources to provide education and advocacy in their communities, working with persons who are living with HIV to develop initiatives that are going to change public or organizational policies in order to stem the tide of the impact of HIV-related stigma in their community. Campaigns that focus on those spaces, social, faith-based, special spaces where people are feeling the impact of stigma, where there's an opportunity to increase knowledge and to get rid of the myths and misunderstanding in order to address stigma. And that might be in a faith setting, in social settings, and even in healthcare settings. And even a combination of interventions. So it may be individual level interventions coupled with group level interventions in order to effectively address stigma in those spaces. We truly really only have one focus area that dovetails into two directions. So SAC is going to fund applicants who are seeking to build interventions related to addressing HIV-related stigma at the development or adaptation stage, meaning that you may already have a program that you're doing in your community that you have a hunch works really well, that has been well received, that has been community informed, where you need some support and resource to formalize that program, to pilot that program, to evaluate that pilot. So if you have a program and that could be applicable, we will fund it on level one, the development of that project, or if you are currently implementing an existing intervention where there's an opportunity to build in a module or some additional elements to the intervention that will specifically address HIV-related stigma, we will also fund adaptation and piloting of that as well. Secondly, we will fund the implementation of an intervention that the applicant has previously developed or adapted. So if there is an intervention that is homegrown that you all have developed and piloted and would like to see implemented and seek support for that implementation and the cost of that implementation and evaluation, that is the second area of work that will be funded through our RFP. You'll notice that we talk a lot about evaluation. It's important to note that through the Southern AIDS Coalition funding, we work very closely with Duke University as our evaluation partner. And in that, what we hope to do is to identify through these funded programs, scalable, fundable interventions that are effective at reducing internalized HIV-related stigma and capable of being replicated elsewhere in the South. So we do realize that there are a number of sociocultural aspects of developing and implementing programs in the Southern United States that we need to recognize. And so this is an opportunity for us to actually ask very specific tailored questions that may be applicable to communities and regions like your own so that they can be shared. And it's important to note that what we've also seen is that organizations have been able to create programs that are responsive to the way that stigma is showing up in their respective communities and the way that it is showing up. For instance, one of our current grantees realized that one of the areas where their clients were feeling stigmatized was around the ability to be employable and the ability to be self-sufficient. And so their intervention includes an aspect of entrepreneurial training and job readiness. And so recognizing the way that stigma shows up in their community and us being able to evaluate through our work how we can best see how that could be applied in other communities. So really wanting to make sure that we are taking the lessons learned both quantitatively and qualitatively and seeing how what you do in your own community could be replicated elsewhere. So the key takeaways: your intervention design must be community informed. And I think all of our takeaways across the CCs speak back to those core values that Nina shared at the beginning. So the intervention design must be community informed. Please make sure that your proposal is very clear about the way that persons living with HIV and those who are marginalized, traditionally marginalized in your community, are involved in the development process. Clearly illustrate how the addressed stigma shows up in your community. Paint the picture for how you're seeing the specific type of stigma show up and impact the community that you're serving. And be sure to identify costs related to program development versus implementation. We want to understand the cost of the incentive for a focus group. We want to really see very clearly how you are planning to utilize your budget to support the programmatic aspects of actually developing your program, as well as what that looks like in implementation. So just making sure that your budget very clearly mirrors the activities that you lay out in your proposal. So at this time, I'll talk a bit about some of the more nuts and bolts aspects of this grant opportunity. I noticed that someone in the chat asked about which states are the 9 Deep South states. And here we are with our list: Alabama, Florida, Georgia, Louisiana, Mississippi, the Carolinas, Tennessee, and Texas. Services, programs must be located within these 9 states to be eligible for transformative funding. You must have a 501c3 or a fiscal sponsor, and a letter from that fiscal sponsor will be required for your application to be complete. 12-month grant period beginning January 1st. You will be required to complete organizational surveys and other evaluative tools during the process. And you must agree to work with an evaluation partner at your coordinating center, as well as the Compass Initiative's overarching evaluator, ETR. Additionally, there is only one application per organization. So yes, you must select which of the 3 CCs you plan to submit or you would like to submit your proposal to. You cannot apply to more than 1 CC. Funding is for up to $100,000. Even for collaborative programs like the one noted by Emory, the total budget cannot exceed $100,000 for your project. There's a range of unallowable activities which can be found in the RFP, and we ask that you read those very closely. You'll notice that most of the activities that we note are unallowable tie back to our commitment to those core values, making sure that your activities are inclusive and thoughtful and strategic in the way that you are servicing your community, persons living with HIV and those who are marginalized within your community. And would also like to note that projects that focus on or include funding for PrEP, service delivery, are not eligible or allowable expenses under this funding opportunity. The application submission, we hope, is crystal clear for you. You'll download the RFP from gileadcampus.com. And once you've downloaded the RFP, we encourage you to really have a strong sense of what all you need to pull together. Download and review it so you have a strong understanding of what documents will be required. And then you will utilize our online grant submission process to submit all of that, again, at gileadcampus.com. We're very happy to tell you that you can save your work through the process, so you don't have to worry about getting the entire application done in one sitting. If you require support around your proposal submission, we encourage you to reach out to us. We do recognize that an online grant system can at times be a barrier to folks, and we don't want it to be. So please reach out to our team if we can be of any support or assistance to you. Please send an email to info@gileadcampus.com and note in the subject line, technical assistance portal, and we will respond to you as quickly as we can to provide you support. Additionally, we also recognize that some organizations may require or be in need of some accommodations. And depending on the capacity of our centers to do that, we will be glad to support you. So if there is a need, for example, translation services or some other type of accommodation that will be helpful in your organization submitting your proposal, please email us as soon as possible so that we can see if we can actually fulfill your request for accommodations for the proposal. And lastly, the deadline for submission is Monday, September 23rd, 2019, 11:59 p.m. Eastern Standard Time, 10:59 p.m. Central Standard Time. And we do recognize that the South is across both of those time zones, so I want to make sure folks are crystal clear about the deadline for submission. So the component of the applications, again, can be found in the RFP, but we do require that you must complete the project narrative and supplemental materials that are laid out in the RFP. These materials will be uploaded through the portal. So you will not be emailing your supplemental materials. They will be uploaded through the portal as well, including the provided project budget template and work plan. You must submit your 501c3 verification or a letter from your fiscal agent, as well as an audit. If your organization does not go through an audit process, the most recent IRS Form 990 must be provided, as well as a list of your board of directors, as well as a diversity table template that is provided. MOUs or MOAs and letters of support are optional, but must also be uploaded through the online grant submission process. We also like to be very transparent about our review process. The Transformative Grant Review Committee is made up of independent reviewers who are required to complete an acknowledgement of any conflict of interest and determining which applications are reviewed. Our team takes we utilize a very clear process to determine who reviews which proposals. Those review committee members are from all of the 9 eligible states, representative of the various programmatic areas and focus areas of the CCs, and they follow a very clear rubric. And our review committee for last year was made up of 30 reviewers, 15 of which are persons living with HIV in the South. Again, just want to remind you, applications are due September 23rd. We will send out notice of funding in late October to early November. A public announcement will be embargoed, so we will ask that no public announcements be made until we get with our awardees around a World AIDS Day recognition and announcement. I apologize. The grant period will begin on January 1st. The grantee convening, tentatively scheduled for New Orleans, Louisiana, will be in February, and the grant period will end on December 31st. Please also visit gileadcampus.com and go to the grants page so that you can register for our webinars. In addition to these informational webinars about the RFP, each coordinating center will have will hold a webinar to talk specifically about our focus areas. The first one up will be the Southern AIDS Coalition webinar on reducing HIV-related stigma on August the 28th. On August the 29th, the University of Houston will host a webinar around their content area, and on August 30th, Emory will host a webinar around their content area.